joining us today. It's a privilege, and thank you to Barnett to have this opportunity to present on implementation strategies for an eTMF. We are in a very exciting time in our industry. We have many organizations that are working in paper and have identified the many, many benefits of going to an electronic trial master file. And so when that happens within an industry, we certainly need a set of tools that can help us with that implementation. Implementing an eTMF can be very challenging, but I think it really provides a great opportunity to really look at your business and to do some business process improvements. So today what I'll talk about is how you can actually do that within your organization and kind of incorporate this implementation of eTMF along with opportunities for process improvement. So as Barbara said, my name is Donna Dorzinski. I've been in the industry 26 years. I spent the first 15 years of my career in big pharma working in clinical operations, predominantly early development. During that time in early development, we had responsibility for our trial master files because we didn't have the support that the later phases did. So in addition to all the other things we actually did trial master files. So I actually remember setting up files many, many years ago, kind of with that deer in the headlights, okay, how are we going to do this? So over these years, TMF has evolved significantly. I've spent the last 11 years as president of Just-in-Time GCP. We work with clients in setting up operations, clinical operations to support FDA regulatory and international regulatory inspection readiness. And TMF is a huge piece of this. I've been involved with the reference model, the DIA reference model for the last several years, and I most recently led Zone 4 revisions for version 3, in addition to working on revisions to many of the other zones. So today we're going to talk about strategies for communicating with your business partners in the implementation of an eTMF. Business partners are a critical component to this. You cannot implement eTMF in a vacuum, so it's really important to think about the impact on your business partners. We're going to talk about 3 techniques for addressing the functional area impact of eTMF implementation, and what I mean by this is functional areas being outside of clinical operations. An eTMF implementation impacts all areas of the organization, and so we want to take that into consideration. We're going to work on developing a list of user requirements that will help you in selecting your eTMF vendor, and finally we'll finish up with some of the key processes that will be impacted by this implementation, and that's where we really focus on this process improvement effort. So what's your first consideration when you're implementing an eTMF? It's really important to think about the structure that you use within your TMF. If you're doing a standard indexing, a lot of companies are using their own internal indexing, and many companies have moved to the reference model. I will spend some time today talking about the reference model because it is quickly becoming the industry standard for indexing, but what's really critical here is that when you're implementing an eTMF, you want some form of standard indexing. You also want to think about what metadata you're going to try and track as part of your eTMF. One of the powerful tools that eTMF provides you with is the use of metadata to help you look for records, identify records, gather a certain set of records, perform your QC. Metadata can be very, very powerful. They are very much system dependent, so depending on the TMF solution that you select, the vendor may come to you with a list of potential metadata, but the majority of your vendors can also accommodate other metadata that you may think is really valuable to your particular program or your particular group of clients. Keep in mind that the power of metadata is the searchability, so you want to think about, will you be searching on that particular type of metadata? So what I mean by that is it's great to collect metadata, and we can collect tons of metadata, but if there's no value in that metadata, then it can turn into a lot of time, because every time you add a record to your eTMF, you're applying metadata. So if you think about that, in the thousands of records that you add to the TMF over the life of a study, if you're collecting metadata that really doesn't add value, then that's just creating a lot of extra work for people. So you really want to make sure that you take into consideration, will we want to be able to power this metadata, or is this just extra information that we're collecting? And then lastly, you want to think about types of metadata that might enhance how you operate in your business. So for example, if you're an organization that does predominantly CNS studies, you may want to collect some metadata around different types of scales, like if it's a CNS scale or if it's a quality of life scale or dependent. So think about how you do your business and what the value is there. If you're doing a lot of international studies, you may want to do a lot of work around language. If you're not doing so many international studies, then maybe language isn't relevant. If you're only doing Spanish or English consent forms, maybe language isn't a piece of metadata that you want to collect. And then lastly, start to really think about the types of conventions that you want to establish. Conventions for naming files, conventions for how you file records. There's lots of ways to file records, and it's really valuable. Your TMF is more valuable if it's better organized. And so as you're going through your just day-to-day business, if there's certain ways that you do things and you want that to translate into your electronic trial master file, then you want to begin to think about that. So these are all really things to start to think about as you move towards implementing that eTMF.